Migraine headaches can be debilitating for just about anybody who experiences them. However, as you can see from this chart, women appear to be about twice as likely to experience migraine headaches as men. And according to the Center for Disease Control and Prevention, many of the people who experience migraine headaches are prescribed opioids to relieve their pain. Now, for those who may not want to take medications, what are some natural migraine headache alternatives? Let's look at the research. Here is an investigation from all the way back to 1998 where 55 migraine sufferers were given 400 milligrams of riboflavin, also known as vitamin B2, or a placebo for 3 months. The results of this study show that 59% of the people taking riboflavin experienced reductions in the frequency of migraine headache attacks versus only about 15% in those who took a placebo. And while that is very encouraging, what about kids? We're not so sure if riboflavin helps kids who suffer from migraines, as is evidence from this study where 200 milligrams of riboflavin proved no more effective than a placebo when it was given to kids for 1 month. Feverfew is arguably one of the most popular migraine headache supplements out there and has been reviewed in several clinical studies, such as this one and this study too, which appear to show that Feverfew, when used at a dosage of between about 50 and around 100 milligrams a day, might either reduce how many headaches someone experiences and might even slow the progression of migraine headache frequency as well. And while that is very encouraging, when researchers lump all the studies together, they sometimes find mixed results. In other words, sometimes Feverfew works and sometimes Feverfew might not work. Could this be due to differences in the brands of Feverfew or the dosage or the processing? It's hard to say. Nevertheless, Feverfew remains popular for those who deal with migraines. Add migraine headaches to the long list of things that CoQ10 appears to help. Here is a study showing benefits in reduction in the frequency of migraines after 3 months of use when 150 milligrams of CoQ10 a day were used. Here is another study showing CoQ10 significantly reduces the number of migraines per month when 100 milligrams of coenzyme Q10 were used. Peppermint oil is a relative newcomer that some people may not be aware of. In this study, 120 migraine headache sufferers were given either peppermint oil placed in the nose or lidocaine when the headaches were just starting. It was reported that both peppermint oil and lidocaine worked about the same at reducing migraine headaches. Caffeine is not a dietary supplement. However, several studies have shown that it can also help reduce migraine headaches when it is combined with aspirin and acetaminophen, also known as Tylenol. Studies like these are probably why you've noticed caffeine listed as an ingredient in over-the-counter migraine headache formulas. Capsaicin, the hot-tasting compound in chili peppers, also has its share of headache research too. In this study, researchers found that topical capsaicin placed on the skin reduced mild to moderate migraine attacks in about 60% of the people who used it. Melatonin, best known for helping people sleep better, has intriguing research that it appears to prevent migraine headache attacks. Here, 3 milligrams of melatonin not only worked better than a placebo, but it also appeared to be equally effective as a migraine medication. In a review of melatonin for migraine headache prevention studies, it was noted that while more research was needed, melatonin was very likely to be a promising alternative for preventing migraine headache attacks. So there you have the rundown. What do you think? Have you tried any of these migraine headache alternatives? Leave a comment below and let me know. Until next time, I'm Joe from SupplementClarity.com. Take care.